Salon directly through the media. We request for taking this opportunity again for tell plenty thank you to all the media partners. I noticed say the media they now they come on time. Congratulations. We're already there, ready for start right at the time we'll see for start 2 p.m. We'll continue for doing this and I appreciate you all for that. So I will tell all the ones that carry this program live. Plenty thank you. And I will also particularly tell you why we don't send questions in advance. Thank you. Every week we announce the topic. We put a link. We get a QR code and we get a link. We ask people for sending questions. Now, if you even inside this room and use that QR code, you don't need for example, themselves, you also use that QR code and you're able to ask a question, and other people are actually able to vote on your question. So the question is listed based on whose question and give thumbs up to. The commitment now for start with their question and they will play the ask online. So we will keep our short and quick. We get more and more, even when you want to ask follow-up questions, you use that day. But the one that inside the hall, we'll get for now. Now we only create that you do big speech. We keep our short, one question per person, so that we'll get as many of our inputs as possible. I just want to remind the people that within our house, say the platform we use and call slido.com, and the code the flyer way out. You can use the QR code and you go there, you just enter your question and we will see the question there very live. Now I'm very glad today say we get a very high powered panel. We get my colleague, the exceptional, distinguished Minister for Health, Salon, with the take care of all well-body business, incredibly hardworking, Dr. Lnformation. He can talk about updates them at the health sector. We say they do, what are the challenges that we face right now, what are the plans that we get, and it will include these subjects who are also expressed interest in the drug crisis in the country. We also get to sister from civil society. When I know say we committed to this space, we make it available to non-governmental entities. In fact, that's what I expect say in the future we will even get journalists there. We will get this topic we're interested for us and join me at the panel and have a conversation. So Matilda Ekan Sonsiama, in a society activist, the rural women there, and they will talk more about their new response, and we say particularly how the crisis they affect female youth. Dr. Abdul Jallo, senior specialist for psychiatry, and the head of the mental institution at the country, and they do an outstanding job. And we don't call IRLs and can share the new updates of the situation and waiting, then they do as well for help with this crisis. Before we hand over to the panelists there, I just want to do a quick summary of some of the highlights of government news over the past week, so that I've been told about accelerating what it's going to do when we start the first 5 minutes, and to provide updates on highlights the way the government of Salon they do, so that the journalists then will get access to this news information. As we go forward, we're going to make sure the highlights are going to be available on the website and all the platforms there, so not to just follow Kagilaya, but we'll get ways then for us to check this information. I'll try to go very fast. One, for informing us, say the ambassador for Salon to the United States, Ambassador Civic Abubakar, engaged in productive bilateral engagements at the State Department with the African Bureau team. We include the Deputy Secretary of State, the Deputy Assistant Secretary of State for West Africa and Asia, and the Desk Officer for Salon in Guinea. The update is that the United States government continues to pledge their support for President Leone in National Election Systems Review, and they not make a commitment say they will send an MCC delegation for Mr. Salon very soon. That successful engagement has been followed by a courtesy visit with Ambassador, while the incoming United States Ambassador to Salon, His Excellency Brian D. Hunt. say the relationship between Salone and the United States continue to be very strong, and we'll continue to get conversations on how we move all the partnership initiatives forward. Another opportunity to share now that the Vice Chancellor of the Regional Maritime University of Ghana, Professor Jethro Brooks, don't sign an MOU, a Memorandum of Understanding, with the Salone Maritime Administration for enhanced training and the domestication of the standards of training, certification, watchkeeping for seafarers, the convention. This will enable Salone to independently train in own seafarers. On Friday, 18th August 2023, the Minister for Internal Affairs, Major General David Taluba, also began a dialogue with the transport stakeholders to remind them of the rules and regulations and the attitudes of drivers and road safety and pedestrians. This meeting includes major players across the transport sector, and they agree for continuing to work together for increased safety on the road. I'll pass quickly to my brother Yusuf Sandi, the Deputy Minister, for read the Salone Police press release with the date 17th August 2023. We'll just read that very quickly and then we go forward.
Okay, so I'll give one for those who are quick.
The Sierra Leone police notes with dismay the increased level of lawlessness and recklessness displayed on our roads by some motorists, garage owners, vehicle owners, motorcycle and tricycle riders. These acts of lawlessness and recklessness have in many ways contributed to the increased number of recorded road crashes in the country, some of which have resulted to serious injuries, fatalities, and damage to property. Against this backdrop, the SLP would like to inform the general public that effective September 1, 2023, the Directorate of Traffic Management and Road Safety will enforce the following traffic measures and regulations with a view to restoring sanity on the roads, ensure the safety of road users, and also improve on the free flow of traffic. First, it shall be prohibited to abandon or park vehicles, motorcycles, or tricycles on the road. Garage owners shall also not be allowed to use any of the roads as a garage. Vehicle, motorcycle, tricycle, or garage owners must therefore ensure that they remove all vehicles, motorcycles, or tricycles presently abandoned on the roads on which are parked for the purpose for repairs. 2. It shall be prohibited to park vehicles on any of our roads in Freetown and in the provinces for more than 1 hour. The police and SLRSA will ensure strict compliance. 3. No vehicle under any circumstance shall be allowed to park on or along the hillside bypass road. Number 4. All bike riders and their pillions must use helmets while plying the roads. Defaulting riders and pillions will be arrested and prosecuted. 5. With immediate effect, motorists, bike and tricycle riders are prohibited from parking on all major junctions along the road leading to and from Waterloo and the provinces. Motorists and riders are only allowed to drop and pick up passengers or pillions at all major junctions. And lastly, the restriction placed on commercial motorcycles from plying the central business district is maintained as still in force. This comes out from the Media Relations Department of Sierra Leone Police.
All right, thank you very much. Very quickly next, on 19th August, Salone being General Continent will mark the World Photography Day, and the team have been building peace and national cohesion through the lens, having made the honor to go join and deliver the keynote on behalf of His Excellency the President at an impressive event now. The Minister for Technical and Higher Education on the 19th of August as well, Dr. Hajar Ramatullah, officially signed a contract with Akal Abhinav Consultants, PVT Limited, a reputable Indian company for the construction of Okono University of Science and Technology. So Fakule will come up for no say better they come for Kono very, very soon. This university, they don't sign the agreement and the work is expected for start very soon. Expected for bridge the gap between classroom knowledge and hands-on application, and focus on engineering, agriculture, and math. Science, technology, engineering, agriculture, and math, STEM. EPA also did on a 3-week intensive raid on illicit dredge mining activities across the country. The raid alone covered areas in the east, south, and northern regions, and over 80 dredges have been burnt and destroyed. And are from the Environmental Protection Agency. And then finally, the Minister for Foreign Affairs and International Cooperation, when we host Minister Naya, Minister Timothy Musa Kabar, being getting first meeting with the diplomatic corps Nassau at the Ministry main conference room. The minister has been telling them thank you for their support to Salone, and they assured them saying will be a listening minister and will continue to work with them for advanced presidentbio in the 5 agenda. So that are all the updates we get today from across governments for now. As I say, we will try to provide this update there as well to now, to send them to now. Feel free to do the question and answer for use the platform or for ask me questions, additional clarification questions on this. But now, for while we all there, I will hand over first to the panelists there all for next, I'll say, it's 10 minutes for frame their interventions very quickly, and then we will open up for hopefully a very good conversation. First on the list, the Honorable Minister for Health, Dr. Austin David.
Well, thank you very, very much, Minister Siba. Again, this is a special moment for we all. Really quite pleased with the new tone. This is a government for the people, and for we able to communicate in a language where even people in our village Nigeria and the area understand what it is very, very important. So thank you very much. Also want for expressing gratitude to the media and this new spirit of starting on time. Because we save everybody the energy and respect you as journalists, respect me as workman and owner, and I hope we will continue this on. So on a personal note, I really want to take the moment for thank His Excellency the President for giving me this opportunity to come as Minister again for well-body business. We do a lot over the past 5 years in the health sector. We established some really, really dramatic gains. For example, the Oman with the diary and Ngedele, we able to dramatically reduce that by over 60%. We were able to make some major inroads into Pekin and Taiwan. We were able to make some dramatic impact on COVID-19. We were able to contain COVID-19. Yeah, we all in the struggle with Sierraleone, not unable to even believe we did it. But we get solid evidence and we're able to manage this much better than anybody else because of the prior experience. So again, I think with all that, we're glad the President gave me another opportunity for serve this nation. So I'm framing the discussion around 5 major thematic areas. Number one, the President is very clear when he says well-body business now, all-man business, and well-body business means that everybody will be included. So when I say universal health coverage, it means they want to look for well-body business. Everybody counts, all 7.5, 8 million of we. And we believe it's the backbone for universal health coverage. Now, we think of primary health care, where you take health care to the people, to the farthest reaches of the country. So now this country also we get the opportunity for shows, say, with over 1,500, 1,600 healthcare facilities spread throughout the whole country. Nearly 85% of the population get access to a health facility within a 5-kilometer radius. The biggest challenge we will get now how you go bring quality to their facility, and so I think that now the work on our travel shelf now waiting to do around that. The second major aspect of that is if you get breakthrough more complex cases where you need to manage the primary healthcare unit, even though we focused on prevention of the primary healthcare unit. You need to get secondary and tertiary facility at hospital level and the district level or the central level where they deal with more complex cases. So over the past 40 years, we don't invest a lot on primary health care, but we not invest enough here on the hospital side. So it's a try to do now to bring some more balance. Intensify the accomplishments of primary health care, will take prevention and care to the people, at the same time, our systems. So we focus on that third avenue for improve the referral systems. And fourthly, health security. How will we make sure that this country will prepare for the next outbreak? We will prevent the next outbreak, and when the next outbreak comes, we're able to respond to it much more actively and proactively. So now there are four major areas we work on now. The fifth component now, you get cross-cutting issues really cut across everybody, and I think that this topic today, an important topic around mental health, and we will talk about mental health and how that related to the push situation. But that now something really span from the pregnant woman all the way to the baby, all the way to the young toddler, all the way to the possibility just before they go to school, all the time when they school, all the way to adults, all the way to senior citizen. So what we try to do now in all of the interventions, including mental health, we make sure that no one is left behind by following the life stages approach, starting from pregnancy to the baby, to the pekin, to the school child, to the young adult, to the senior citizen. So without framing it, I'll really look for, as we carry on the conversation, we'll see which we don't do and which we need to do going forward.
In the drug crisis last week, we've been there and we've had many questions. In fact, even in this week, we'll put out Civic, so many people don't ask questions about waiting at the plan. In fact, the journalists last week say plan A not don't work. Enough people they say we get a comprehensive plan on this issue. Then she say in fact the epidemic, if you want to call it that, now increase. So they lost a lot of young people there. So this, you don't outline the comprehensive approach we can take, the life stages approach. But from the Ministry of Health, can you speak to us a little bit about a perspective on the apparent drug crisis at the country and the steps that we take systematically currently to address this crisis?
Thank you very much. I think that's a very important question, and I'm glad you let me colleague Dr. Jawa join me on this panel. The push crisis, because now real crisis here, something we deal with on a daily basis, we see on TV, we cannot ignore it. It's front and center, it's front and center in our life. One of the things that we know from looking at how other countries around the world and how we set for deal with this, now a societal problem, society, all aspects of society need for be able to respond to this. Because you get biomedical side, and we'll tell them about the biomedical side very effectively. But then you need the security side of it, you need the supply side of it, you need the societal side of it, you need family side of it, you need communication side of it. All of them components in it. It's not so one person, no more responsibility. Important that we all come together and tackle this problem from a different angle. We expertise at the Ministry of Health, now the biomedical side. You know, we will tell now, waiting at the active ingredient, I think Dr. Jawa will share with you, in fact, waiting at the current knowledge base of the active ingredient and how they make them product here. So, you know, let me outline that for you. Waiting will also look for see, waiting at the medical implications for this, waiting at addiction, how they make people and they get this situation of condition, and waiting we be able to do from a medical standpoint. But as I say, We cannot treat our way, sorry, we're not going to be able to treat our way out of this. It really requires all of society, and we will articulate in your side, waiting on the medical side of it. Perhaps the first thing we need to know now, waiting on this push. Because if we don't get a clear understanding of waiting on push, it will be very difficult for us to see waiting on the actions we need to take. So with your permission, sir, I don't say we go back and forth, but I'll let Dr. Jalo help you to understand waiting on push, and then we'll begin to talk about what we need to do about it. Thank you.
Perfect, and a perfect segue, because this question came up in a lot last week. Waiting and push. There's a lot of, in fact, in the question they will not get, a lot of rumors and misunderstanding in place and contact place. People didn't say how now we in our government, now we didn't impose push camp, how now we sell the push, how so, maybe those start stay like how our minister said. Waiting and push and how it affects you clients the way they do it right now.
Yeah, thank you so much, Honorable Minister of Information and Civic Education. I'm with the President of MIPOS, the Minister of Health, for the opportunity. Deputy Minister of Information, for the states, one a big partner there to us for me to be able to tackle this crisis. Because now we go for pass on the information to the general population, people will understand. So I want to thank you for all that. And also able to put in media. This is an opportunity for we, the mental health professionals there, for me really showcase within what they do and within the Ministry of Health they do in terms of not only for mental health but for substance abuse and health in general. And this push business now is a very sad reality for we as a nation. For make we see the rising generation of the nation, they suffer this kind of way. But I want to make we almost say drug business not to sound an international concern for everybody. So this push way people will take especially the young one there. We're not able exactly to know within this push. Because the kush where we know is a synthetic form of jamba, where they add chemical form it become more potent. And kush is some type of jamba. But when you engage the one way they take this kush, they will tell you different stories. Some will tell you say that they get 3 types of kush per se. They get the tramadol push, where they use any kind of leaf, any kind of flower so far, mix out with some chemical and it's very active, very active. Whereas we get the one where they call the Jagaban push. And now any plants, any flower so far, now they use, they mix out with formalin, acetone, we're very toxic. We don't even little bit because formalin nothing really used for embalm body poison inside the system. Now concern for everybody, not only for the health side, even for the community, families.
Sorry, you see that 3 sides?
Yeah, I want to talk about the first one, is synthetic form. Yeah. So the issue of the kush. Now concern for everybody. The family, the community, and again, we not for blame the one that will take the coach or for criminalize them because they say, I would say, not also the fault for becoming an addict. Because the chemicals, the way they put in this coach, instead they will affect some parts of the brain. And addiction a circle where they reoccur because of the craving effect. And the addiction can damage some part of the brain. And we're not able, if we able to reverse that damage in the brain. So the most important thing for me, we stop, make even attempt for takeout. Not for the push, but substance, but any psychoactive substance. You abuse a substance or anything, when you take out, where you don't need for takeout, or you take something in excess. Now that we call misuse or abuse. You can abuse paracetamol, you can abuse morphine, you can abuse alcohol, you can abuse so many things there. Then the substance misuse and mental health, now like twins, because the drug misuse can lead to mental disorders, and mental disorder also can make person take psychoactive substance. But both ways now a big problem. It creates a devastating effect on the individual. Because the drug, they go take the function of the brain all over. Imagine say now you get some mental illness. Then you go take a drug, jamba or push or ecstasy, we're very common now. Nice problem, ecstasy with people take feel lively among the company. So if that push would damage the brain, they get a mental health problem. Now that we call comorbidity. Okay, those two occur at the same time. Then the brain gets function the way they make, like how we talk, so normal one. Then you go take the coach. The coach will make you lack, you only go for concentrate well. You lost memory. You after you don't vex, you become aggressive, violent. Then it will make that you begin to see things the way maybe you see, or talk things the way will not make sense, or you hear voices where you know not very. Then again, it can even lead to suicide. Yeah, if you take drugs, it can lead back to suicide. Then it can, the extreme side of it, make you lose your life. Through the damage where the push cause in our system. The case that where we don't see the representation, they're very unique, because one this crucial cause organ damage, your kidney, the damage, your heart, your liver. Now that is how we see with swell foot and some wounds there in the foot. You see that some parts of the swell. Some as the opposite the teeth. In fact, now the Jagaban push the cause, as you see so the cause, you don't see this is sick. Because of the chemicals that we use, you see that the lip all don't change, the multi-side get some kind of color where a normal person normally gets. So the issue of push is a very big crisis. Then we get data for me we know the extent of this push. I can just go through brief the data. This now data where we collect every 6 months. because Sierra Leone are a part of a network we send data, and this data will help in so many ways for make we able for create interventions there. So from 2020 to 2022, we don't see 2,800 cases of drug misuse. We over 60% of the cases that we present in the hospital. Then there is a huge rise in the substance from 2020 to 2022, from 2% in 2020 to 40% in 2022. We're gonna like 2,000% of increase. Then,
sorry, just to clarify that, because I know numbers oftentimes get confused. So 2,000% increase in the number of drug misuse, abuse cases at your facility.
Yes, at my facility. Not to nationwide,
Also nationwide. So
na the hospital. Na the hospital. Yes, not the hospital, yes. Of them. Then 72% between the age of 20 to 34 years. So imagine the youthful age. And now the president don't carry with this big five, we involve youth employment, field salon, and human capital. And this one all now for we the youth there. So if you don't go take drugs, how they go for employment? You can't be productive. Then nearly 10% now between the ages of 10 to 19 years. Then 1/3 of them they're not getting work, they're unemployed. Then 12% employed. For sure, see the issue of drug, not to just the one that we're going to work. Now all walks of life. The see cases when our skilled people there, when our professionals there, where they abuse, they're in there. So it affects everybody at all age, just like waiting the minister we talked about. And then 60% of them are secondary school. This is very serious. Students. Then 11% the university. That now for 2020 to 2022. So we also begin for analyze for the first half of 2023. And for the data we are not see, it means the drug business don't go now to the university. Then 73% now from the urban area and outside. So now for what we know, these are just from the hospital. So imagine how many people globally outside there really abuse this substance. So we need for come as one, to make we able for tackle this issue, not to just government business. This is everybody. Everybody, be it health worker, be you faith-based organization, be you journalist, be you family member, we need for support and make one of the stigmatize the one day when they take this law. Not to their own fault. We need for support them. Because again, if you deprive person in our community because they take drugs, the person they go into hiding and more harm to the person. So waiting we for do as a community and for encourage them for when they come out and take them for help or support. Thank you.
Some very sobering statistics, yes. Thank you very much, Doctor. I think just to reiterate that this number that we read now of the people that really go now the mental health hospital na Kisi. So imagine if you look at the data now across the country, and people that will not go access hospital there at all. So we're talking about a pretty serious problem. We think particularly, and I come to you back, Doc, next, Minister, that the increase in the past 2 years, it really alarming, you know, from 2% to 40%. And we say also hearing that as a crisis, the predominantly male, a predominantly young, a predominantly urban, and it affects the most productive years of the young people of this country. I'll make you reflect on that, Doc, and see what else you have to add about what this mean and how you, as the minister, they incorporate and prioritize this, because I know that you know how we can prepare about these things.
Thank you very much, Siba. I think this is a very sobering information. That makes it really important for that we know what to deal with. Again, allow for the echo the minister in statement and Dr. Jalon's statement. This numbers where you see the premier teaching psychiatric hospital in the country. Yeah. So they look at the raw numbers for work with, but the proportions don't mean much because the proportions can be different, you know, on the side. But it is every say that signals is something seriously going on. Yeah. So the key question now, what should we do about that? Yeah. Now that we don't know the problem, what should we do about that? If you come to like the special advisor on mental health, the president don't appoint the vice president for chair this mental health interministerial interagency. I mean, as you everything the doctor says is no. You know they expect the nurse them to go interdate and run after Jambasela and you know the medical side we get role for play. But clearly you get role for play by major other ministry then. And we're not left on anybody in hand, but not to me, not to me, not to me, not to me, not the government side. So the president appointed vice president will bring a complete interministerial team to look at mental health in general, but then also look at this drug issue specifically. So the kinds of activities that we deal with right now, from the medical side of Dr. Jalo, as you mentioned, he gets a treatment center, he gets a rehabilitation center, Nakisi. We want to see how we will expand that. We see, say, for who NGOs and they pop up, we want to provide psychosocial support and preventive measures. We, the ministry, they try to identify that group here for giving technical advice, for giving technical support. And who side they need medical help, we want to assign nurses and psychiatric nurses for support them because again, I've seen in the old people and they shave their head, they're tired, you know, you really can't do that. You know, so we get people that within the mental health community, we do for support their NGO there. So, and similarly, we train more staff, them not only for Freetown, but for the whole country. So that we will deploy them psychiatric nurses there, so throughout the country and look for support at the local level. But the key message there so far we are, it therefore take the society as a whole to manage this. Again, forget social welfare for the active participants, forget social welfare for support. You need drug enforcement agencies, you need the security sector for preventing chemical hazard from coming in. It requires families, it requires schools, it requires teachers, it requires parents, follow all work together. Because the one message I get for all man, yeah, this is not something we for try. This is not something we for taste. Because when you taste them, it will go deal with your brain, it mix up your brain such that now you don't even forget control. You get craving. How any normal person who will take formalin within the food now for the body, for preservative, for smoke and use as ingredient. How anybody will use acetone, one of the most toxic chemical agents, within the use for remove that nail polish with the hand? How you will use that nail for ingesta? Imagine what they do to you. The swell leg they went in the system, not to the leg you get for look. You just see your kidney don't damage. You know, for manage the plumbing again, for manage the water and the fluid movement, and make you get them and you know, for cow again. It will cause lasting damage. And again, this is not something we know for experiment, not for trial. But we will only succeed if we all come together. Let me work with this interministerial and get a real clear task force acting. We will not start slowly for move this forward. Again, you need for diagnose the problem and then we'll get a collective solution. Again, not a medical solution are the only solution, yeah. It requires everybody for come together and prevent them in the first place. And if we never for prevent them, people will not fall victim. Let me give them compassionate care. Let me pull them kind of close to me. Because, you know, 13 years, 14 years, 15 years, 20 years, 21 years, you get another 40, 50 years ahead of you. We know we'll sit down, that life live well now. So we get an obligation for treatment, compassionate care, for turn them around. When you need medication, we'll give you medication. When you need clinical care, we'll give you clinical care. But it requires a lot more than a medical solution. I mean, I'm glad we'll get this meeting, because at the end of the day, Siva, I want everybody for asking themselves the fundamental question. What do you mean we do about that? Not to waiting doctor and they do, not to waiting Dr. Jalo they do. They do in your part. But what you they do? When you see you begin try for do something wrong, you see your brother do something wrong. Again, it's not to just unemployed youth. When you see people with coats and necktie, yeah, the thing of one name push product here, so it make you want to sleep. Yeah? It make you want to sleep, and you don't want to sleep. So now that fit in between the sleep where they don't come and they affect the sleep. Now they cause bro, you imagine you sit down on a motorcycle, yeah? You want to sleep. You take medicine for let you sleep, but you don't want to sleep again. What's in that they cause for you? The other one where they give you extra energy now, you need for control the energy. I see them put one on somebody they bought the pole. Yeah? And no one see that. The problem because it didn't look funny with the laugh, but not so simple laugh. Because now somebody bothered on it. And somebody insisted on it. And again, we for work together as a nation for trying to manage this.
All right, thank you very much, Honorable Minister. Now, on the question of what you do as a citizen, we don't make that clear as this platform, not just we from the government side, but also for you the ordinary amazing citizens of Salone they do. And for like you said, a chance for listening to citizens and made them share. We get on with well today, Matilda Sonsiama, who are also an activist on this issue, and particularly the work with rural women. We then issue typically the this na main issue and all. Even if you get 96% of men, there are 4% of women sometimes that they can be lost. So this question of internal diversity and making sure so we reach them one day. So I'll give an opportunity now to Matilda, but just share briefly with Pablo and House how you don't see this crisis and what you and your company and our organization they do for response one.
Congratulations to you, Mr. Chelnoba, and to Dr. Finembi and Yusuf Pepe Thomas and Mr. I want to say congratulations to now on our appointment. And I want to tell you, Mr. Ba, that I really appreciate him because before now we see the weekly press conference like in which way we family carry my on the street. Nobody understand what we really talk. But now that you do an interview, I want to say thank you. Me now Matilda, and basically I work with human beings, even though I work with everybody, but to some extent I watch myself say me a feminist. I know they feel for talking any side. And because I work with women then, at first, push, yes, we all know say push now a crisis where they move from bad to worse, we don't live for either than they move from bad to worse in our society. And it become alarming or distressful to me, where I begin see, I don't see women they smoke I will make her decide for do engagement into them. Now where I begin engage people and say women they smoke them. The first thing we make I decide for engaging to push business now because the first people the way we see first time for see push now woman they sell them. And it is so disheartening that woman we get 3 boy picking, they get neighbors we full of boys for sell push. And I ask them say, Ma, what are the reasons where you think say you they sell push? You don't think say you they destroy the community, and worst case, now the community where me they live, not other community, the community where me they live, where now the Bay community, Thompson Bay, operating road, it is happening within near water, where now one is why say we not get more educated people than because we just say we use them to go astray. Then you can begin sell push now for worsening the situation. No man tell me say they sell push because push they get fast money. And they get to take care of them. I was like, so you picking them where you sell push for take care of. You know they say and say at the end of the day, if you sell them one day for taste them, where it will become an addict. And if one taste time you see you not do nothing, and you know that you will do nothing because you sell them. You know things say that they ruin you, family way things and make you they make, and you are part of a community. You they sell push. This push they destroy the community. You think say the money where you they make, it go better you. You must say, now sell it they sell. And not pay person for go buy them. We go I will laugh now, but it's very disheartening that nowadays majority of push sellers now women. Majority I can talk about any size, a majority of the push sellers now women. Last week a video be out, I don't know if that where was there who are the streets, where they see the old woman and all where they sell push, even the argue police and all. Because to some extent the woman, the people they watch and say they get police backing or they get security backing. These people where they sell push to some extent, they get their ways around where they pass. Where the security personnel where we think say for help we for eradicate the push things they are the worst set of people. Because now then they give these people backing. Every day we see that they arrest push sellers and push takers. And after 2 days, go there back, they meet the person they sell. So it be very disheartening that we women then now we see young ladies they take push. And anything woman put on back. Just like when we can always say what a man can do, woman can do better. When we put on and push, we the worst pass demanding. Because me, that man to some extent, therefore, we women we put on and push, you are absolutely a prostitute now. In fact, prostitutes will not pay. Because the moment you take push, you effect for sleep. Just like our dog say, you and the sleep you are referred to myself. Why you not refer to yourself? You get people where they take advantage of you because of that. And during me visit to so many ghettos in and out of Leone, one thing I made for understand, okay, Mr. Jallo say, we get 3 types of push. That synthetic push, it's not that common again. The tramadol push, where they call now gentle push, and Huawei itself say they call Jagaban push. It's Tramadol Kush, a mild, perhaps now we can call a gentle Kush. The Jaraban Kush were very, very deep, very, okay, in the queue right now past the gentle Kush. Because there's not two available, readily available. Me get a backyard garden. Just last week I wake around 4 in the morning because I began before 4, I began for travel for Gogo and I go and travel with Adex. I wake in the morning, I meet different sets of people, they pick cassava leaf, na me garden. This is best than they pick cassava leaf because they have to make push. The other boy tell me play. The other boy tell me play. Why I ask and say because what come now afraid. As a woman for coming out do that day, not only a man coming out afraid because I see for different possibilities and come for put that than this. Hey, auntie, don't feel bad. I can't slide if I pick. What did they pick as well if this for? Not to anything bad as something I want to make. As well, if you don't tell me say you go cook up, they say you go make something. That's now push, obviously. And we realize say we women them. Not only when they sell push, because then they take push now. Women make the highest number or the highest percentage of Sierra Leone population. And if we young ladies them between the age of 15 to 34, where we regard ourselves as youth, they destroy with future. Say we take push because of depression, trauma, unemployment, and the likes. It will be very, they are made to understand from Dr. Jalo say 1/3 of you push takers are unemployed. Yes? Because then they watch and say, I don't go different ghettos in and out of Freetown. But more especially we focus districts now, Western Urban, Western Rural, both, and we own district corner. It was surprising for us say we get degree holders. I get a colleague, when me and go Jara University, he was a senior. Now if I see on the street, I shed tears because of push. At one point in time, I asked him, say, why you decided to take push? He said, Tilda, I don't graduate over 4 years now. I don't get a job. I got a family to feed. And somebody introduced him to push say, because you know they sleep. Just like waiting dogs say, not even taste them, because when you taste them, it become addict. Somebody introduced him to push say, because you know they sleep, take push, you go sleep. You take push, now he's an addict. Yes, because now sleep you will be once, now he didn't sleep. So you know even the degree they don't even value to have. Because they sleep. And we young women are really into push. We don't need for items say, woman know they take push. The woman they take push, the rate is alarming. They not only they take push now, majority of push sellers are they repeat now woman. And 80% of who that they sell push, obviously to some extent, everybody around them gets for take push. We really destroy the society.
All right. Thank you very much, Matilda. I think you don't add some different elements to this. You don't bring a very human elements to it. You don't add with me and Doc being the whisper to each other just now. The economic angle to this. That we acknowledge, obviously, that past 5 years, globally, even as a group, people that they face economic challenges. Jobs for young people have to come by. The colleague will just refer to people that they seek different options for get solace. And but the important message is, if you go that route, like our doc says, an irreversible route in most sense, on most occasions, as you know, we will come back. If you choose that, if you taste, also the guys really say that taste last starts, and then you know, we mean like John but say I will stop. It's really important for the family and I will know this point where doc says just now, Dr. Bembi, is what you for do. And if you're a young person, the first thing and the most important thing is don't do it. If you're a person, we get person that you like to do one, that for family, for support the person and help the person to make the transition, not to for criminalize them. Now for the first round of questions, I'm going to try to read through the questions we have on the platform, and then I'll open up to the problem. What I'll do, I will blend the question name and then I'll pass that answer quickly. Then we will open up for answer. The first question about whether drug crisis is not just a male issue. I think we already addressed this and how it affects male differently from females. If there's any distinct effects on males versus female, I'll give you a chance to respond. Any specific training protocols that they want to implement for healthcare workers across the country for how to deal with people that are drug users. Reports of deaths resulting from minor procedures in Sierra Leone, both in government and private hospitals. What steps the ministry will take for you, Doc? How the ministry work for foster trust and confidence in our healthcare system, especially considering these adverse events that you mentioned in the previous question. I think again, you don't address earlier on, but maybe you can share additional lines. How civil society ensured interventions and programs and gender sensitive. I would like for you, Matilda, talk about specifically which kind of intervention that you think they could work particularly for women versus men. And this one, important question, whether any specific mental health interventions or therapies in the way particularly are proven to be effective for treating drug-related disorders in a context, or as people say, ask, are we doomed? Is this really beyond our control? And then, Doc, there's a question about massive ships without right now alone. The question is how many sierraleoneans will benefit? Somebody asked about whether we will use WhatsApp or ask questions. Oh, another question where I really want to answer to Doc now. Whether push the come up from salon or outside salon. I think this question persistent because again the misunderstanding how that somebody imports and can in the country. So just clarify that they straight up about whether kush imported drugs or na drug we make na. I know some are not using English synthetic all that. But only talk that they direct the break and clarify to people whether and then somebody asks whether this crisis don't reach a point for law declare a public health emergency. If this crisis don't reach a point, or we think will be the threshold. Okay, I will tap it. Tell family members, thank you, don't even ask the question. If you didn't able to ask a question, you can vote on the question as well if you want to ask that question. And I will just give you a chance to respond. I'll start with Doc on the left, and then I can see the minister, Matilda, and I can type about 2 minutes. So,
yeah, the first question. If woman is affected with us. One thing about drug or mental health, it affects any gender, either you be man or woman. But certain drugs today will more common in men and others in women. So for example, alcohol. Alcohol is more common with female than male. Yes, alcohol is from evidence, from body of evidence. Yeah. Then the other one they talk about interventions. Yeah. With the Ministry of Health, they work in collaboration with the National Drug Law and Enforcement Agency. So from that collaboration, they able for establish a drug treatment and rehabilitation center now. Now, because of that collaboration we don't train addiction specialists there, about 27 nationwide. Now, because of that collaboration we don't train core drug educators there for raise awareness about these drugs. So, the intervention currently we will do Nakisi. Now, Doc, I want to be looking for maybe flush the drug. We know the flush. what we do is we get what we call detox. That's not for when patients present with them with withdrawals or with mental health issues, then we be able for detox the patients. Then after that, we offer counseling at the hospital. Ideally, a drug addict, a lecturer, there is no amount of medication we will make that person stop for take drug. Now the person in willpower, 9 for able to say, me, I don't make up my mind, say, I'll stop the drug. It's difficult. So we basically have not for support the person for better through the process of the addiction. Addiction is a very bad thing. Don't you all talk about protocols. Yes, everywhere you go, there are SOPs and standard operating procedures or protocols or guidelines. We follow literally when we treat or care for the people there, especially with some they working present with physical health conditions because when they take drugs, you go likely get HIV, hepatitis, you get syphilis, a lot of things because the drug they cloud your sense of reasoning. Okay. Yeah.
So a couple of sides maybe I respond or react to. First, reported deaths in the public and private sector. We monitor and very, very closely. We get births and deaths as part of the Civic registration, and we get in fact, we just received about 10 complete mortuary units for the tribe to distribute throughout the country. So we'll make sure say normal deaths are reported, abnormal deaths. We get pathologists that we will investigate and find out what kind of cause of death. In terms of trusting the system, I really want to say we did try. We did try. We know which days, but we did try. But I'll tell you something. If me get major medical emergency as to why I need surgeon now, I need top doctor there, guess who's that? Connaught will try for upgrade Connaught, and a few weeks ago we opened the emergency side, although attack can't come fully, but we able to fix them. We bring and come back to speak. All the top surgeon there, now Connaught and they. You'll be surprised. The other day they do the first minimally invasive thoracic surgery. Now that's not Connaught. The other time we open the laparoscopic surgery, you open the whole prostate, you open the whole belly, the chest surgery pass, you open the whole chest, open somebody lungs. Now, small pots, and then you go on the side, then put camera, then put instrument in it, and correct them, and come back. Small switch up, you the heal fast, they take almost the 7 hospital. So that any kind of improvement in there with the brain come, but people that don't know it. So we need to expose now and see what may go on. Right now, if somebody make one mistake, it go all over social media and I all one area. But the good hope that when they go on there, so they try with the doctor, then they try, not able for acknowledgement. So I really they ask that we continue to put pressure on the healthcare system, but also acknowledge we need to make progress. So I'll work on that. Right now, as we speak, so the West African College of Surgeons, the top president, vice president, they are today. We can maybe host the next, the 64th general meeting of all the surgeons in West Africa, including most of Africa and Europe. The only come now, the second week of March of next year. So we're in the process of planning for that. And they come side with lost cause. The kind of side where you see get tremendous potential now. So, and that's how they speak. I want to talk now. 3 o'clock. 4 o'clock, they invite you now for go by Wataki. You see the largest hospital ship in the world. They can't dock now, so mercy ship. If you dock now this evening time, then get on board about 300 different surgeons then we don't do search all over the country. We don't get about 5,000 potential candidates that we register. We get all kinds of ailments then. Out of the 5,000, then also select 2,340 we will benefit from major surgery they have. So the both school doc now at Akile for 10 months. And not only that, they're not the only time do the surgery. The medical school, all of the top surgeons every day in residency, they all can join them for able for do the surgery, not only for do the surgery, but also learn new skills. And the West African College of Surgeons there now for certifying them training. And at the end of that training, we all will be certified as well. This should back really come and help you for establish the School of Dentistry. So you get a few dentists that will already go out for training. They already come back. Inside this 10 months, we'll bring them together to establish a new dental school. So, incredible opportunity. The largest ship in the world, hospital ship, 90 cars, so and we're really pleased with that. On the issue of import-export, I mean, clearly, you see some of the products. The other day we see somebody bring 500 million of tramadol, will be way above what we would expect in this country. So then confiscate them and seize them, then block them, I think, then destroy them, certificate. So we don't want to then kind of product when they come in. So the security sector, we really have worked very, very closely for identify them product there, so and able for interdict them before they come in the country. Like formalin, acetone, you have dual-use products or multi-use products. They want them to come for specific purpose, so we need for control them a little bit. So only somebody will need for use formalin, forget formalin may have. Anybody else we didn't see with formalin, you know, the law for ketchup. You know, anybody when they use acetone, we also for nail polish, you know, you get a problem with need for people for intercept around it. So again, it requires community awareness. It's important for the people that the docs and the boss that know their issue, so we'll provide content for them. And we provide support for them. But together we can do this. One last thing on the emergency situation, you get a threshold and we closely watch the situation. We closely watch the situation, we work with everybody else. But clearly, this is not a new thing. A new thing to be. With drug prices, not a new thing like the world. Yeah? But Anosis Salon, as resilient as we are, we will for conquer this. And we listen to lost cause, not to say some of the things we doomed or not. We're not doomed. Yeah. There's a lot that we can do about it on the prevention side. There's a lot that we can do on the management of it. There's a lot that we can do on the care of it as well.
I guess the question when somebody say the interventions on gender, if we are gender sensitive. Drug case, to some extent now, we don't become gender sensitive because it is affecting both gender. It affects women, like it affects women. And we decided not to be gender sensitive because you watch and say, if you say you focus on man, the more you focus on man and left woman, the moment you realize the woman herself don't take them, perhaps waiting they don't take, the one they don't take and they don't go past the man the way they focus on. So at this point in time, we are set for both woman and man, even though me, as a feminist, and I pay more attention to women because I watch and say, women don't lag behind. Our women are not educated. We fight for equity. We don't fight for equality. Now, since we fight for equity, we think say the best we can do. Now that the few people when we get there, before with the time we level them for say they are not part of this push to them forward.
All right, thank you. Now I'm going to hand the microphone over to you. Please name quickly and your institution, and you ask the question. Try to keep them brief, so we'll take as many as possible. Go around. First with a very distinguished brother, Mr. Omo Fofana, you and the
African 1 minute after 2 are late. Bravo, very good. And I'm happy that we also have this in Creole. So my questions. Mr. Minister, I'm not going to answer this question about whether or not it's an emergency. But based on your observation, based on what we don't know as of today, what Donald Trump do with opioid by declaring this an emergency so that resources is a very, very serious issue. I mean, the reason being, if the figures will get not only for the Kisi Psychiatric Hospital, it tells you the larger scale out there that we do not know about. So that if you declare a health emergency, it will get the much needed resources and the attention for dealing with it. Because make no joke, this is very serious. There is hardly any area in Sierra Leone where we don't get a kush crisis. Last 2 months. And I went to some areas and spread. And it's cheap. Because it is cheaper than even marijuana, there's a mad rush towards it. So maybe the declaration of an emergency go help stem up. And my question also related to this in the sense that, and Dr. Diallo helped me with this for no waiting right now, waiting at the current situation. I go to the Kisi, like a very lovely place, very nice. And then I see one side in a rehab. The structure completed, no beds inside. And there are a lot of patients going in there we need rehab. But that rehab structure not get even mattresses and the things that we need for taking the huge number of patients when they come to the facility. I want to know whether the current state of that building, if it's not been furnished, we go for hold the one that we get mostly push-related mental health issues. And back to number one, whether you advise the president for declare this an emergency. Thank you.
Thank you, sir. Yes.
And again, I am assistant leading on media network. This question will go to the Minister, Dr. Austin Dembe. If we agree for majority of the young people then come back in our society for contribute to national development, and majority of them when they for come back, the team will for push them out in a stigma. As a result of this, what in the ministry they do for CC they change the 1902 Lunacy Act, we don't pass over 100 years.
Thank you. We get a question there as well last week, so I'm happy that it's back now. Yes.
Mina Suleiman John, I write for the Expo Times newspaper. I asked this question to Dr. Jalo, where he continuously talk about the one way they take push, we don't blame them. And you see, most 1/3 of the affected youth are unemployed, So we don't blame this doctor now. Because you see, we don't blame them, being the fact that they know the push is very dangerous at their life, and at the same time they take unwillingly. And the question to the Minister of Health.
I see one question per person. Yes. I'll keep on that with it, please.
All right, thank you.
Yes.
Yeah, okay. Mina Samantha.
First one.
Okay, the question they go like this. And the question they go like this for treatment options. Now, this is a public health concern for we all in Sierra Leone. So, Mr. Minister, the question where I want for us, what are the treatment options like free medical? Because most of these cases, we say like they get their foot, their swell, and also for the woman then. We almost say then woman they are also involved in this abuse here. So the society, a lot of people they take advantage of them when they expose them to sexually transmitted infections and teenage pregnancy. So what are the treatment options that were available? Free treatment options. Thank you.
Thank you very much. I'll let somebody else with it again. Yes. If you come before we use the mic.
So we experienced the operation.
You want to move to the front and use the microphone? Somebody press that last mic before I want to. Yes. Thank you.
Mr. Minister, we did see that the border is a push down. Police and the way there is meetings, even so yesterday we see many meetings. And you mentioned earlier, say, doctor mentioned earlier this say, they're not the one by themselves and they're not for blame them. So whether they be sent and arrest them here and go lock them up, you feel say that a better way for keep them away from then they take that dog say order for go out over and so now but they never lock them up easy.
Thank you very much. I think I'll stop here for now and give the panel a chance to respond. We don't get some really excellent questions. Should we declare it a public emergency as a means to mobilize resources? Uma will mention within during the US opioid crisis. Questions on the Lunacy Act for you, and then treatment options, particularly whether we explore free medical, including for women then, and whether the option is the lock-up is the best option or not. So, Mr. Minister, you first, and then I'll come over to you.
Well, thank you. Again, a very, very good question. For declare a public health emergency, you need for me setting thresholds. And I think that we work very, very closely on that. And we will engage the presidency and the vice presidency around it. Again, one of the things that we say are little famous for, we're not making unilateral decisions. Usually it requires some consultation, bring all of the parties together and set some thresholds where if you see it will trigger the declaration of an emergency. And when you declare an emergency, it gets immediate implications for us. And I know Sinana is something where the presidency will consider, but let me get everybody together and get the arguments in place for the group to do this. The critical piece of that now is some of the data. Again, the data will get on one facility. If it portend or if it gives you signals say there's a whole lot more going on, or we don't really know what's going to go on in the rest of the country. So I think say you need a panel of experts for come together and advise the government around that. So for example, we Director General tell us they declare an emergency, it will bring a panel together. So all their minds will come and advise, and we will do the same thing also. In terms of the Lunacy Act, one of the most ridiculous acts in this country from 1902. I just want to assure you, see, in this next iteration, the second iteration, one of the top priorities for repeal the Lunacy Act and replace that with much more current and meaningful act. Parliament before we only do a lot of consultations. In fact, we get a draft bill. Now we will aggressively pursue when things settle down a bit. On the issue of treatment options, I think it's very important that we understand the root cause of what you will deal with. It's easy for you to mend the swollen limbs. It's easy for you to patch the sore foot. It's easy for you to treat a sexually transmitted disease. But if you do all of that and you're not able to handle the fundamental issue of the drug use, it will be extremely difficult. So I think we will look at all the solutions and the treatment options. We'll see how we will first get the person in a safe space and work with the person in that safe space and create an opportunity for them. Again, it will become really dangerous because not only the push you deal with now, there is some people that use needles to actually inject the kush inside it. If you use that now, you don't really expose yourself to HIV. If you mistakenly give an kush treatment, HIV can go and cause an even bigger problem. So now something we have to deliberately look at and not to a one-person decision. We all need to come together and see this kind of option and what they give. But the stigma issue is so paramount on all this. Nobody will come for treatment if they arrest them. Nobody will come for care if people in the stoner. Yeah? We get from figure out a way not to them false when they get addicted. Yeah? but they don't get addicted now. Now, the responsibility for work with them and see how to find that middle road there, how to get them out of that situation with compassion and care. And at the same time, it looks like not double punishment. Somebody who is vulnerable, they begin to take push, we hold on, we lock off. First we see the lock off. Yeah. We don't lock off now. First we sell the push in the China, they make the push the sell now. So we have to combine an aggressive pursuit of the one hand we do the supply side, as we manage one hand we are victims of this with compassion. Again, I'm not saying unemployment are a major driving force for this, but the one question what they ask, which unemployed person, which person will they take push today, we don't benefit from it. We don't make life better. So we get for asking fundamental questions and work with the people that will bring income in or manage the situation and give them compassion and care, and at the same time so we go after the one that will perpetuate this as well.
Okay. Doc, apparently the treatment center question for you. The treatment center, what was the second question? Yeah.
Let me question around this.
What is it you don't do it? Finally, the question.
No, again, we owe responsibility. We owe responsibility. Again, Sierra Leone get one of the worst reputations in the world for psychiatric care. They lock people up, they chain them, they animals, and put them in a cage. Yeah? We don't move away from that. Years ago, we say, they say, we Dr. Nine, and the only, we don't go past that now. We don't modernize the care. We forget. The other day, I put in Asumi, had this swell with pride. We didn't get the pediatric side. We didn't get anxiety, we didn't get all the kinds of things. They get place for them, they able to manage and work with them and involve them. And you have to please for yeah. So we don't change, and they get trained more psychiatric, they get more psychiatric nurses, they get more critical care nurses. They provide more services. The place is well painted, really quite nice. But we will look into them building a mattress business and ensure, say, if that's not a missing piece, we do everything we can for support and going forward.
I just want to announce again, say, my ambition of also end the press conference on time, and the time working Civic is set at 3:30. So I want to ask Dr. Jallo to try to keep on really sharp to this question.
Yeah, I think the Honorable Minister of Health, the answer the first one, the blaming. The other one talk about pitting with the Minister of Health answer, but we just want to talk about the human rights aspect. No matter which effort they take, no matter which they commit, the human rights, we get for respect them. And for patients, because I was not patient enough, they abuse the human rights, and that's not crime. Thank you.
This Kush situation, an imported drug or not? Please answer this question.
As a member of the advisory board of the NDA, currently, within how we observe is the law enforcement agency don't do the best. That they chase the one they sell this thing. So now they make the push locally, locally made. Although few they come in, but not to the push they come in. Because the push now, just like I said, they use any kind leaf. So now the chemical way they use for mix, now they will carry. But now the rates don't reduce. Yeah, thank you.
All right, I think important for them to know, say, this whole idea, say, how to put it at the top, and then the imports and come, and then they make money out of them. It's not true. because people then they use cassava leaf, we just hear a different substance then for make them push. I'll give Matilda a chance, 1 minute for response.
Yeah, however, as a civil society activist, we basically human rights now a must for me. I say for people that beat the victims or patients, it is totally against the right. If they beat the patient, they don't hold and arrest the person where they sell, or you arrest them, call police. After 2 days, they give you $1,000 million, or less than that, you release them. Then you say you detect the push business. Why we community stakeholders, the way they try to enforce that thing, not for do that. The best thing you do, bring out the push sellers. Because you bring out the push sellers, the problem will be minimized. Where then they beat them, now infringement upon their rights. Where totally they are against the human rights, and we know they support that as civil society activists. Because you know, somebody know they suffer one case, then you think, say, for all and beat time or the life, now this not the solution to the problem. Bring out our push sellers and let the law enforcers, more especially the salon police. Me and the big salon police. These are our enforcers. We are when they can go push sellers then they don't watch the selfish part of it, the $1,000 million for less than what they give you. You release them and destroy a whole youthful generation. Because the police mean at the top of any side, I get 2 evidence now here where they don't arrest push sellers when a woman. After 2 days, you go there, you meet them. But a police can't leave. And you one day where a witness where they even get, they catch you somebody they smoke with the cell, who cell you point to the cell woman there. And after 2 days, the cell woman will see her back in the society. So they are the big salon police. We know they say they own bad name, they always say that they take by body, and let them minimize that bad push business. They are the big because they affect to the civil society. We go out there, we try we level there for try for integrate people, and just like how the sister said, we get people where you go don't talk to them. You don't talk to them, they are willing to let go. Why the stigma back with the pain, we are civil society that we do in level there. Or talk to the community. I want to ask her please speak. I want to ask her for talk to the community people there for allow the It's very more sensitive, sir. I want to ask her okay. We do the best for talk to communities there. These are just these TikToks are come down. Allow them back in our society and see what's in them will be. Thank you very much.
Alright, thank you so much. I want to take this opportunity for telling our friends thank you for Munakan. I want to tell thank you to the distinguished panelists there. And I want to tell thank you to family who don't join our hosts and when I always don't make use of the platform for ask questions. This week we get the highest number of questions on our platform. And I think we don't do a good job of answering as many of them as possible. You will believe you get a heart-burning question we will not answer. I invite you for use one of the ministry engage them for ask you questions, especially if you're a journalist who want to do stories. Hold on, please. Don't interrupt. Okay? Don't get a conversation that is civil. Yeah? We open the platform. You also get a chance to ask through the platform, through the online space. So as I said, all right. Okay. Hey, Mr. Man. You see, one game person can be a bad fish and boil everything for other people there. This is an example of where you get the right to ask a question. I only explain to you how you get your question the answer. You can ask your question on our Facebook page. You can ask your question on Twitter. Most often I get my number when a journalist today are from a press house. Ask me that question. Dr. Dembi as well don't make himself available. Even last week, some journalists they reach out to me for specific question then coordinated to Dr. Dembi, and the journalists will get an exclusive interview and get in-depth responses. One thing we try for doing our make sure we create a space for that we do mutual, respectful conversation. But now let us mistake.
for a second. Let not doubt, not think, say, because we talk so nice and easy, that you will come here and take advantage of we or misbehave or relevant one. Because we will simply just plan you and look again. So I don't want to get to that stage there. I'll all thank you again, and I will see you again next week there. We will send out a particular form for asking for feedback on today's conversation. I really encourage the journalists to follow up on for good feedback so we will make up even better. Assalamu alaikum.